Hello, good evening. How are you day? Welcome to another session of Ask the Doctors. This program holds every Sunday by 8 p.m. Nigerian time. Now, on today's program, we are doing a question and answer session. Means that if you get any question for us today, we will try our best to answer you. Sure you understand? This program done the whole for 5 years running. Every Sunday for the past 5 years, myself and Dr. Israel Robonose. Now we dey here every Sunday, we dey answer questions, we dey teach. The program starts by 8 p.m. and it ends by 9 p.m. I beg, remember, we know they give number, we know the private chats, but we go try explain one or two things for you, make you understand. So on today's program, we go take some questions because I hear a lot of people say they won't ask questions and we know they get a chance to answer them. So today, if you get any question where you want ask, try ask, and we will try by the grace of God to respond to you. But remember, we not go prescribe medicine for you. So how you dey? Where are you watching me from? Drop in the comment section. Tell me where are you watching me from, so that make I give you small shout out. And then we will start to the answer your questions, question and answer session today. But tell me, where you dey watch me from? Oh yeah, let us go. I can see say I get people they watch me on Facebook and some people they watch me on YouTube. So anywhere you dey, how far now? How are you? Oh yeah, let's go. No, ask me now. Oh. In case we don't end and you dey drop your questions, that means you came late. Can you see the time? So if you dey watch and we don't end, we don't go fit answer you. But if you just dey come now and you get question for me, oh yeah, drop in the comment section. Make I see whether I go fit respond to you. Oh baby, how are you? My guy, how you dey? Happy Sunday. Hmm? Let's go. Ma see whether you dey hear me. Ma check whether you dey hear me. Ma check. Okay, yes, the network and the sound they work. I see you. Gladys is watching me from Cameroon. Sarah is watching from Sierra Leone. Janet Nikki, I'm watching you from Liberia on Facebook. Very good. Janet, how are you? So ask me your question now before people start to dey drop questions, because I don't want somebody to come here and start saying, but you're not answering me when you came late. Now open day, nobody won't ask. Oh, tomorrow now, if I'm gonna start teaching, when I go to teach something, somebody go come they ask me another question where we say no day related to the topic. Now im make today we are doing question and answer. Okay, Marcy, share this live session. Share. Dr. Israel is going to join us very soon. You will they watch me for YouTube, where I drop comments now. Why are you like this? And then later you said you did not answer me. You did not answer me, but you didn't drop your comments on time. Hmm? Let me see if I have any question here. I not get oh. Okay, no problem. So I made a post earlier this evening and I talk say a lot of ladies go suffer well. A lot of ladies, where they drink postinol. Any small thing, when you meet your partner, you go they drink postinol. Hey, you go suffer. Because you think say postinol na vitamin C. You don't know say postinol na something wey be say you go just take maybe once in a month, or you might not even need to take it, but you can't dey drink am every time. Hope you know say postinol no be family planning. Now I go lie for you. Postinol no be family planning. So if you dey drink postinol every time, you can suffer in the future. You fit get problem with your period. Your period fit disappear. Your period go travel. You con dey cry. If you can't get problem to give birth to pikin, you can't dey get issue. And doctor, I no fit born oh, I no fit ovulate oh, I don't know what is happening, because you don't go drink a lot of postinol when you dey young. So I won't beg you as a woman here, stop abusing postinol. Postinol not be family planning. And if you define family planning, enter clinic, they go explain to you the different types of family planning. So that make you no come tomorrow and say, had I know, had I know, had I know. You dey hear me so? Stop to the abuse posting. No, if you no wan suffer. Oh. Good life. Now waiting. Good life. Na sense so. Okay. Now I get some questions there. So as I dey answer you, make sure so you share the video. Good evening. My name is Angel. I have hot womb. What do you mean by hot womb? Madam, who tell you say you get hot womb? What do you mean by hot womb? I don't understand. Angel, throw more light quickly. Huh? Good evening. Is gastric the same like ulcer? So we have what we call peptic ulcer disease. There are different types of ulcer. We have what we call duodenal ulcer. We have what we call gastric ulcer. We have what we call gastritis. So when you say gastric, what's be your name? Francisca. Your comment no complete or your comment get K-leg. So what exactly are you asking? Because listen carefully. Some people go just wake up, give themselves diagnosis. I get gastric. Madam, how do you know you have this problem? Hmm? Okay, and so as you dey ask me question, be sharing. I dey check for here. If you no share, I fit ignore your question. No, or yeah, share. Huh? Very good. Sarah says, what causes pain on both the left and right side of the stomach? Anything can cause you pain. Plenty things can cause you pain at the left and right side. Anything can cause you pain. Plenty things can cause you pain. It can be from anywhere. That is why you will have to go to the hospital. May them check you, may them examine you, and may them do test for you. Sarah, huh? So there is no way we can tell you why you they get pain for left side, why you they get pain for right side, because there are many things inside your abdomen. So the only way to know what they cause you that pain now for you to go hospital, make them examine you, and make them do test for you. Hmm? Good. That is how you will know. Mine is not coming, just 2 days. So come. There's a problem here. There's a very big problem. Dr. Israel is in the house. Okay. Let me bring Dr. Israel up. If you they ask question, try ask your question so that we go fit understand what you they ask. Huh? You say mine, you say you get hot stomach, number one, and I told you to throw more light. You say your hot stomach is coming 2 days. Is it your period? Madam, explain. Write it well. Make we feel understand. Yeah? Uh-huh. So Dr. Israel is in the house. Let me bring up Dr. Israel. Dr. Israel, good evening. How you there now?
I'm fine. Good evening. Happy Sunday, and I hope we are all doing well today. And Dr.
Yes.
Fred, good evening.
Yeah, I see you. Good evening. Welcome. Happy Sunday to you. So today now question and answer session. Now we dey do. And I just noticed say some people they ask questions. So before you ask questions now, let's do something. I'm gonna be checking the people where they share this live session. If they're not the share, I go look for the person we share, and that person I go the answer. You understand? Now another person I got the answer. So let me check first of all. Let me check. Just give me time. Make I look for the person name we share, and then let me see this person name. Okay, none of them don't share, Dr. Israel. None of them don't share. So what we go do be say somebody they ask me question about say he get hot stomach. I can't ask him say what he mean by hot stomach. He can't talk say in whether na in period they flow for 2 days. Full stop. So what would you have to say concerning that?
Uh, that not get anything to do with hot stomach. Well, it constantly depend on the age when this person day. So if he notice a period they flew for 2 days, and that one not be the normal for him before, if that not be the normal for her before, then if he need to try see a gynecologist, oh shit, NEPA.
Bele?
If you need to try see gynecologist because anything fit happen. And how is that 2 days? Is the blood the medicine they flow well or it not they flow well? So that
Mm.
na another thing we need to know eh, before you know what to do. But I think the best thing is for him to see the gynecologist. If he never dey reach him menopause, he need to see gynecologist. But if he don dey close to menopause, I don't think he should be afraid of anything. He just relax. Na one you mean say na one of those things when person don dey reach menopause. And when we say person don dey reach menopause, na those people wey dey within the age um 45 to 55, that na the menopausal age. So if you don dey around that kind 43, 44, your menstrual things fit dey change, your period go dey change one kind. Some people no go dey see am all, some people no go dey see am every month, some people fit dey see
Mm.
am every month, some people the number of days fit change just like that,
Mm-hmm.
because e dey try dey tell you say you go soon stop to dey see am. That's it. So for you, you say you be 19 years old. So I think you will need to see your gynecologist so that they will know what to do for you. If you really they see your message for just 2 days, and if not be normal for you right from time.
Okay, now I dey see say that they share the live session. Very good. Janet don't share. Let's answer Janet. It says Dr. Fredostar. How does not have to first Fredostar? My period is very irregular. This whole month, I never see him. I haven't seen it. What can I do to get it back? That is to get your period back regularly.
Okay, there are some people when their period they irregular, and it just that now so their body just be. Eh? For some people. Now, most of the time, we're not really too worried about when your menses they irregular. Mostly, if you're not just ready to become pregnant. But if you are now getting ready to become pregnant, then we can now start looking at it to make sure, say you ovulate and you become pregnant. If the thing really they worry you, if the thing they may give you some medication when go really try to make sure say the menses come out. While sometimes if there's nothing serious, it's not like you are looking for a child, it's not like anything serious. The fit even tell you say just don't stress yourself and make you relax. But if it has always been like that, say you now so your menses they always they irregular, I don't think you should stress yourself until maybe if you don't ready to become pregnant or you want get pikin, then you go need to see your gynecologist.
Janet, we
Dr.
don't
Fred.
answer. Yeah, Janet, we don't answer your question right now. Now, one thing where I want to add, I just believe, say, I think this is the first time where this thing they happen to you because you commented this month. So, according to which Dr. Israel talk, if you know they plan to get belly and adjust this month, you go need to wait. But if you know, say, it don't they happen irregular, and you they try to get belly, see your gynecologist. So, Janet, we don't answer you. Chima, don't share. Maybe we answer Chima. Please, why is my stomach biting me for the past 1 week now? First, I thought it was typhoid. That's not how to spell typhoid. And I just finished taking my drug, but I still feel it. So I know they like hear this typhoid stuff. It trigger me. Okay, Israel, I beg, respond, I beg.
Okay, first thing first, Chima, you never had typhoid and your stomach biting you. There might be so many things where they make your stomach bite you. It depends on what you they eat. So you need to still check what you they eat, the water you drink, and maybe if you have not dewormed for a longer while, you also just need to deworm. And sometimes your stomach feel never they bite you, not if you they do you, if you be saying that your mind they play trick on you, they tell you say your stomach they bite you. So you need to check all these things. And another thing you suppose know, if you are not if sometimes if you know people be say they bite you, it's just they do you buru buru, they make sound and all that. It just mean that maybe the stomach is just having a lot of gas and maybe it's not settling. So
Hmm.
what I would advise is that just relax yourself, eat your normal food. But anyone when you take and you see say na increase the pain or the biting when you say they bite you, or if that biting they make you they go purge and say you can't go toilet, go stay toilet for days. Now you need to go hospital so that they go try test that stool, make dem see if there's anything, any bacteria or any viruses or any fungi wey dey cause the problem for you. And if the thing is so severe, then they may want to do other investigation to be sure what is in the stomach so that they will know what and what to do for you.
The person where they ask about stomach dey bite am, so you go dey drink typhoid medicine. The guy, listen, you no get typhoid though, and you people are just go dey drink medicine anyhow.
Dr. Fred.
Yeah, can you hear me? You dey hear me? You dey hear me? Okay. So if you dey get abdominal pain, e dey bite you, dey bite you, dey bite you. If you know say this biting don pass, be careful. Enter hospital. No go drink medicine. Wey you no know wetin you dey drink, make you no go get problem. So Dr. Israel is back. Let me bring back Dr. Israel up. Okay. We get question here from Peace Oluchi. Good evening. Please, what is the cause of back pain and constant waist pain?
Okay, when you say back pain and constant waist pain, so many things can actually cause that. Because if you watch, you say back and waist, they are together. They like say that they're the same line. So for you, I can even say your sitting position can just be the cause of your problem. Do you sit in a place for a long time? How do you sit in that place? So for some people, when you they work for kind of place when be say you go sit down for one place for a longer time, you need to at least once you still stand up, stretch your back and all that. So what kind how you take dey sleep, which your bed, how e be? Na the bed wey be say you will, if you enter, you will go inside or you go dey on top. So that can still tell us another thing. Trauma, injury to the back, or if you be woman, you don first born, dem give you na maybe you use surgery born and dem give you injection for that your back. Yes, you fit still dey get all those pain even when you even born by yourself. Sometimes some women can also be having those waist pain due to childbirth. So there are so many things wey fit cause am. And if you don first get injury for that back, e go fit cause am. If maybe, as I talk, the most commonest one na the kind of place wey you dey work, how you take dey sit down, how you and if then you still dey overstand for a longer time, e can also give you those waist pain. So you need to check those things, check your lifestyle and see if there are some things you need to correct. And you dey go gym, dey do exercise, you go dey do strong exercise wey come be say your waist come make gum one time come shift. So you fit come dey get waist pain continuously. So Dr. Fred, any other thing to add?
Well, for the waist pain or the back pain wey you talk, just like you mentioned, the thing wey fit cause am plenty well. And there's no way we can actually do that diagnosis for you here. Because I notice say a lot of people they want me we give them the diagnosis here. There's no way we can diagnose you. So if they ask us question, what caused my back pain? There is no way we can give you the diagnosis on social media. You understand? Because wetin dey cause am, e dey very plenty. So find out if na wetin you dey do. If you get anything wey you dey do wey dey cause am, maybe. But if there is nothing wey you dey do and the back pain is very severe, you go need to enter hospital. If you just dey come, you dey welcome. Today na question and answer session. If you never share the live session, share the live session quickly. And if you just dey come, you go need to wait because people don dey here before you. I have been having my period for 5 days, but recently I've started seeing it for 3 days, sometimes 4 days, while sometimes 5 days. Is this normal?
Okay, Dr. Fred, you dey hear me?
Yes, go ahead. I dey hear you.
Okay. Yeah, for this lady that is seeing her period, he saw it 5 days before and now it's 3, 4, or 5. I go still talk say it's not there's nothing really bad about it. Because menses now for the way we dey see menses, some people fit see am for 2 to 7 days. Yeah, within that range. But the thing is, this your message when you come to see like that, you go need to ask yourself, um how frequent you dey see am 5 days, or wetin you do dat period when you see am 5 days, or wetin you do the period wey you see am 3 days, and how plenty is the menses anytime you see am lesser day or longer day, or period of seeing your menses. So those can also tell us if there's any other thing wey we go dey think about. But if there's nothing, it's just that you dey see am sometimes 3, sometimes 4, or sometimes 5, na im be your issue. I don't think you should be worried about that, because it dey happen like that for some persons.
Hmm. Yeah. Thank you, Dr. Israel. If you just dey come, you're welcome. Maybe try see whether we fit fast. Please, my chest is paining me with my stomach. Wetin be your name? Oluwa Bukola. Your chest dey pain you with your stomach. You go need to go hospital. We cannot diagnose you here. Anything can give you chest pain. And listen carefully. We are not on social media to use anybody condition play. So in as much as we are trying to answer you, that does not mean that, oh, if you get chest pain, we'll tell you may you go buy medicine, because chest pain can be very, very severe. Wetin dey cause am we don't know for online. We don't know online. So if you dey get chest pain and you dey get abdominal pain, you go need to enter hospital. We will not diagnose you here. We can't do that because this is social media. Yeah, I beg. uh Let's see. Good evening, doctor. I used to have this body itching. I complained to the doctor in the hospital. She prescribed something for you for 10 days. After finished taking the drugs, the symptoms came back again. What could be the cause, please? Dr. Israel, won't respond.
No, Dr. Fred, you can respond.
Okay, so the best thing for you to do is let the doctor check you again, because it's obvious that something now they cause your itching and that medication is not working out for it. Wetin be your name? Comrade Shehu. So you go need to see the doctor, make them check you again, because they don't give you medicine. The medicine work, and then after the medicine finish, the itching came back again. So you might need more evaluation. Maybe you get something where they happen to you for your environment, or something where they cause your itching where they miss. So the best advice for you is to let the doctor check you again, so that they fit help you find out wetin dey cause am. Do you understand? Because we don't even know the type of itching where you get. We don't know where they itch you. We don't know how severe the itching be. We don't know when the itching starts. And there are many factors to consider. So I would advise you, Comrade Shehu, let the doctor check you again quickly. Good evening, doctor. What could be the cause of reoccurrence of infection? Plenty things, Dennis. Plenty things can make somebody they get reoccurring infection. Number one, poor treatment. If now you they treat yourself, you fit they get poor treatment and your infection fit they come back. Number two, you no complete your treatment. You don't go develop resistance. Number three, reinfection. So e then treat you, the infection go, the infection can't enter your body again. So poor treatment, resistance, reinfection, or even a problem with your immune system, or even a problem with your hygiene. And I dey see this question commonly. People go they ask every time, I they get infection. When you ask them, who they treat you? I don't they buy medicine they drink. But if now medical professional they treat you, and this kind of thing they happen again, then e go good make dem redo a test for you to find out wetin dey really make that thing come back again. I don't know if Dr. Israel has anything to add to this.
They're going to need to do re-evaluation for the person. Sometimes, waiting they really cause infection for so many people now. Then they use their hand, they cause them. Like as you said, that mostly the hygiene aspect, and not completing their treatment very well. So those two things they cause a lot for people. And also, if now via knacking and what would they call STI, you need to, apart from you treating yourself, you need to also treat your partner, because if you treat yourself finish, you not treat your partner, and your partner fit already get the infection. If e still come meet you, you go re-get am again. So that
Hmm.
it can be like a cycle, a cycle. So once you treat yourself, mostly once you have a partner, depend whether na urinary, whether na UTI, whether na STD, once you treat yourself, try treat make your partner treat themselves as well. And this one I see make us dey always dey talk say make we dey protect ourselves even when we dey knack and any other things when we dey do. Uh-huh.
Okay, thank you, Dr. Israel. The people where they watch us for YouTube, you where they watch us for YouTube, drop question. I want to answer you on YouTube. Click on the like button for this live session and share. I find it very, very sad that our people cannot support you with liking and share, but they want to ask you question. Now, witchcraft be that now? Share now. Thank you. God bless you. Good evening, sir. Please, sir. What could be the cause of having pain during intercourse?
Okay. So many things will make somebody get pain during knacking. I go just make am dey simple, so that because I know say everybody wan hear one of it, and that one when they wan hear now your first talk, which is infection. I know say na most people wan hear. Yes, infection can actually cause pain during knacking. Yeah, that na one. Number two, the size of the rod eh, fit still cause pain eh, during knacking. How wet or how dry the lady be for that place fit still
Hmm.
cause pain during knacking. Number four, how rough or how gentle then the knacking be fit still cause pain. What kind of styles una dey use when dey cause the pain? Some styles dey wey go cause more pain than another. However, it now depends on the two of una, as I said. And so I don mention like five things. So you check am which of them you think say fit dey cause your whole pain. So if you don check am finish, you don already know the one wey dey cause your whole pain, then if na cause me pain, make we try not dey do am, or anytime we do that style, make we dey very very gentle. Number three, if na be say e too big or and that place dry, you go use wetin we dey call lube. That one go help to make am dey free, because if e dey free, that you no go feel the pain at all. So this one na just the few things I fit tell you about that. And yes, Dr. Fred.
Yeah, thank you. You might also have a cervical problem, cervical issue. If you get cervical issue, may fit dey cause you pain as well. So you go need to check am. And there are many many things to discuss with you if you talk say you dey feel pain when knacking. Some ladies go tell you say it just starts, or now from the beginning of my life where I dey knack. Some maybe now wetin they do them from small when they grow as women. So many things they involved. But if you notice, as according to what Dr. Israel talk, and the rod too big, the day wet, if not that one, if not infection, or you might have a cervical problem that might need a doctor to check you. Uh-huh. Let's continue quickly because of time. If you never share, people on YouTube, I want to answer those on YouTube. Asika on YouTube, I see you. Good evening. How are you? Let me go to YouTube and answer YouTube people. Wait till they come. Let me look for YouTube question. YouTube people. Let me take. We have one question here on YouTube. Haruna Solomon says, Dr. Israel, good evening, sir. Can person feel college hepatitis rate 2 times? I don't understand this comment. Dr. Israel, do you have an idea?
No, I not get. Whether na can person fit get hepatitis two times, but you should let
Times.
us know. Make it
Yeah, yeah,
right
yeah,
time so that we
yeah.
will understand the question.
So I want to take questions from people on YouTube. I they find them because people on Facebook don't to ask questions. So let us give people on YouTube. Maybe answer their question because we also did live. Let me see. I get one more question here for YouTube from Adaeze. Doctor, please, does pile have cure or now only control it gets?
Okay, pie get cured, it's treatable, so it can be treated. And even the one where they call control or the prevention on the is also part of the treatment. So
Mm,
pie can be treated. So the only thing what you need to do, the pie treatment is based on the grade when that pie will be, and whether na 1, 2, 3 or so. It depend on the grade when the pie be. Neither you take the treat am. So once you know say yes, let's say I get pie, that's hemorrhoid, go hospital. Make the doctor. Most of the time, you need to see a general surgeon. So I make the examiner see how
mm,
e be, and then they go tell
mm.
you the kind of which type of the treatment when they go give you, because that depend on the wetin they see. Now they take the treat am.
Okay, thank you, Dr. Israel. Before we continue, first of all, the people on YouTube done the plenty. So you where they watch me for YouTube, everybody on YouTube, give us a thumbs up, like this live session, and share. Thank you. And you where they watch us for Facebook, share as well. So people on YouTube done the plenty. Maybe we answer some of them, I beg, because now only Facebook people then just full years since morning. Let's go back. I'm coming. Okay, I took a 2 months family planning injection. And after expiring, it took me 8 months before I saw my menses back. And ever since, my menses flow is darker and changed from 5 days to 3 days or 4 days.
Okay, that is what one of these things family planning can actually do. So when you take family planning, it's not like it's bad though, but when you take family planning, it actually altered your normal hormonal structure, at the normal hormones they do for body. So when it don't alter am, so that make you not get belle, after you don't stop to the use am, the body need to take time to
Mm,
remember how the things first be before. So for some people,
mm,
it take a very long time for the body to remember. In some cases, some people will even need to take some another form of hormonal drug to make the body remember. So, oh, now so it first be before. So for your own case, and I don't want to talk about whether the mess is dark or whether the mess is not dark. That are not they very important. But
yeah,
just know
yeah.
say now because of the family planning when you take, so the body don't change to that extent. Say you can't see your menses either 3 to or 4 days. It's not like it's not bad. It's not bad. So the only thing I go talk is that, are you ready to become pregnant? If you are ready to become pregnant and you they notice say pregnancy never still gree enter, you need to see
Mm.
your gynecologist so that they can walk you through any process, eh, to make sure say yes, you become pregnant, and everything will be fine. So, but you are okay. Just know that you are okay, even though you dey see your menses for 3 days or 4 days. Not be bad blood. There's nothing like bad blood, because my mind they tell me say you don't dey think say some bad blood don dey your body, because you dey see am 5 days, now you dey see am 3 days or 4 days. Say the remaining
Mm.
1 days, the bad blood wey suppose come and not green come out. Nothing like that. There's no bad blood. So na just that your body don't change, don't regulate to mean say na 3 days or 4 days now you go come dey see your menses.
Yeah, thank you so much, Dr. Israel. The questions are pouring in. People on YouTube don't plenty. Yes, I see you all on YouTube. Click like and like, and thank you. God bless you. Good evening, doctors. Can hepatitis be cured?
Okay, this question I dey always dey very careful when I dey answer am,
Hmm.
so that whatever I say will not be used against me later. Yeah, hepatitis C, no, hepatitis B, there are medication for it. Now that medication you fit take am, e go make you dey very good. E go reduce the viral load to to the barest minimum. However, anything can rehappen. It can come up again and all that. So we dey always dey keep am to that extent say, make we just tell you say it is better you don't even have it than to have it. And if you not get am and you test yourself say you be negative, please take the vaccine. Because if you get am most of the time, for most persons, most cases we've seen, They fit take the medication, they'll go do test, they'll still say, oh, we are it's negative, we are free. After some time, if they go do the test again, they'll still say it's still dey positive. So with not dey really I cannot fully tell you that yes, it's curable, but I know say they can give you medication that can bring it down very well.
Okay, let's take this question quickly because of time. What is the cause of sores in the tongue and how can we get it sorted out?
Now there are so many things that can cause sore in the tongue or the throat as well. So once you know say you dey get sore throat, tongue and all that, first thing you know say there are problem with your maybe your mouth, your oral cavity and all that. So when there's low immune system, that is one of the things that can actually cause those injuries, sore and all that. So common cold can also cause it. So some people
Mm,
will get some let me just say issues where their immune system low. I no wan start to dey name some of the kind of disease wey fit cause all those sore, but most of those disease dey always dey come when your immune system dey very down. So for this kind of person that is having sores in the mouth and all that, you need to go to the hospital because they will likely run a lot of tests for you, and so that may they find out what can be causing this recurrent sore in the mouth. So with that, they'll be able to know what to do for you and how to treat you.
wetin be your name? Your name na Asika. If you listen to what Dr. Israel said, if you dey get recurrent sores for your mouth, enter hospital. But if say maybe you just dey now, maybe na just once, it just happen right now. If it be maybe stress, immune issue, try rest. Eh? But if you dey get recurrent sores in your mouth, carry your body enter hospital immediately. Okay. If you are just coming, you are welcome. Share this live session quickly. Share, share, share. People on YouTube are asking a lot of questions right now, and they are liking this live session. Let's take this question quickly. Good evening. Please, heart-related issue. What medication can be done? Dr. Israel, this question be like this.
Okay, Chinwe, uh, I will just tell you, you don't put medication for that, so you don't already see tell us say we will not answer your question because when you say please heart related issue, what medication can be done? It's like you're asking me what medication you can use. Yeah. So if I get that, maybe that's what you are asking. So we know the prescribed medication for this live session. The only thing we do is just to try to educate you and let you know what next to do, which is always see your doctor, go to the hospital. We never want to tell you to go pharmacy or go lab. We will always tell you go to the hospital. For anybody having heart related issue, should
Mm,
not come online and be looking for one medication or another. He need
mm,
to see a cardiologist, doctors when they specialize for heart, so that make the doctor check the heart, tell her may
mm,
go do some investigations. With
mhm,
those investigations, they go know which medication or what and what to do. So that make you not go take medication online when you suppose come dey better, you go come dey deteriorated, you come dey go down, dey go down. And by then when you come say, oh, this don reach the time when I'll take run reach hospital, the doctor will come tell you say e don late. So for you having heart related issue, please and please, you should have a cardiologist that you are seeing in a regular basis. If you not get this one, na the advice for you: go hospital, a general hospital, teaching hospital, or if you get any better private hospital wey cardiologist dey, go make dem dey see you, so that all this your heart issue related issue can be solved. Thank you.
Thank you. Our time is going. People on YouTube are really asking questions and they are liking. People on Facebook are not even liking and they check. Okay, hello, doctor. Is waist pain and knee pains normal for a guy over 34? My job involves a lot of sitting. Is this work related or size or weight? Dr.
When you don't
Israel.
put size and weight join am, I begin to think what is your size and what's your weight. However,
Hmm.
if your work is more of sitting, yeah, your waist pain can just be related to your work. Eh? So what I
Hmm.
would advise is once a while, after you sit down for a few minutes, stand up, stretch yourself. Eh?
Hmm.
Stretch yourself before you go back and sit down. But you can also decide to go to the hospital and check, oh, what is wrong with my knee? Another thing is that if you have injured your knee when you did small, when during playing ball and you not treat am well, it can come back later in life because
Hmm.
those injuries, those things wey we don do when we small, when we think say we be Superman. So some of those things we can revisit us as we dey grow old. Eh? Can revisit us as we dey grow old. So e go come make our work when we dey do become a bit stressful. So when you sit down for a long time, you bend your knee for a long time, it can actually cause those things. And if your weight is if you are, now, your weight is everybody weight, you will still need to reduce your weight. Yeah.
Yeah, yeah, please share, share, share. Okay, let's take from Hawa. Good evening, doctor. Can clomid cause missed period?
Dr. Fred, answer that.
Okay, so Hawa Mara, because this Hawa asked one question, she can't ask another one. I dey see the other question here. The other question which they ask, does missing period on clomid mean someone is pregnant? Now, this is the first thing I go tell you, Hawa. If you take clomid, where doctor prescribe for you, and you miss your period, e mean say maybe you dey find belle abi, maybe you don get belle, maybe. If you take clomid, doctor no give you clomid. You take clomid because somebody tell you say make you take clomid. Listen carefully. You are playing with fire because you are not supposed to take clomid without doctor's prescription. Clomid can scatter your life. Many ladies they collect clomid on the internet and we dey laugh them because when problem happen, you go enter hospital and you go spend money. So if na doctor give you clomid, you know see your period. Most times maybe they try to get belle, they go check you. Are you pregnant or not something else? But if now you go take cleaning by yourself, number one, you might have put yourself in trouble. So first of all, check yourself whether you get belle. If you don't get belle, carry your body enter hospital, make them check you. Clomid should never ever be no touch am unless doctor give am to you. It's not be medicine where they carry, they drink anyhow. It can show you shege o. I swear to God. Please. Okay. Let's go. If you never like this live session, like now. People on YouTube, I see you very well. You too much. They are liking and it's increasing the number. Now, this question is here. Ma, take them quickly. How do you improve or build a stronger immune system? Dr. Israel, I beg respond.
Okay. Uh, Temitope, to build a strong immune system, you need to first of all cut down stress. That's one. Then two, eat good food. When we say eat good food, we not say eat fast food or eat junks. We say eat good food. And good food consists of everything we go give you balanced diet. Your fruits, your vegetable, your normal diet, but all of them that you know, so when you eat and you give you a balanced diet. Take a lot of water. Yeah,
Hmm.
take a lot of water. Rest. Let rest be another thing when you go do, and not forget to eat, and not forget to do exercise. So when you
Hmm.
do all these things when I mentioned, when I talk about exercise, not be the one where you dey trek, they go walk. Oh, that not be exercise. The one where you, the one where you decide to do by yourself as exercise. Yeah. So
Hmm.
exercise, eat good food, food that contains fiber, your fruit, take a lot of water, and when you take all those things, and then you the rest then in that way reducing stress, eh? Then they do exercise. With that, you are building your immune system. And the way when you take measure your immune system, you will notice say you not dey sick anyhow, you not dey get
Mm,
stressed anyhow, you not dey
mm,
tire anyhow. People dey cough around you. Eh? You now you be the before you even get that cough, you mean say the almost the whole world don get that cough before you get am. Then you will know
mm,
say yes, my immune system it don really dey up. And another thing is that you can actually just go and do a general checkup if you also want to measure your immune system. Do a general checkup. General checkup. They will tell you your blood count, all those stuff, and in that way, you will also know your the level of your immune system. So when you are able to do all those things I mentioned, I bet you don't even need any supplement when it go cost you 1 million naira. Yeah,
mm.
these simple things, your immune system go dey built.
And try to make fruits a part of your life. Eh? Try to make fruits a part of your life. I don't know why people know they like to eat fruits. So try if you can. Fruits will also help you very well because of the nutrients, the vitamins. Okay,
Yeah.
let's take this question here. Doctor, if person they eat sand, which type of doctor will you advise the person to go and see?
That kind of person need to see a psychologist and a psychiatrist. That's the doctor when the person go see, because those are psychological issues. It's a psychological issue. I know of somebody when they eat a chew stick. Chewing stick na be you na you dey eat. You know they use that see chew stick. So in fact, we don't talk, we don't try, make sure say go see psychologist and all that. They've removed all the stick in her house just to make sure say she not the see stick eat. The one with their car, they don't remove her and all that. Because if not say she not go eat them. But because she they
Mm.
see her, she go always eat. So for you, you know you cannot remove sand from the world because of this person. So this person needs to see a psychologist and a psychiatrist. That's the doctor he will see, a psychiatrist.
Okay, we are almost running out of time. Our time don't they go down. Peter on Facebook, please, sir, how can I know that I have HIV?
Okay, Peter, to know say you get HIV, you just to do the test.
Hmm.
Yeah, it's just to do the test. You go to any hospital, they do the test, but it go make sense. Say even when you dey go any hospital, make sure say those hospital na the hospital when they also they manage HIV. Reason why I say so is because those hospital, uh, one, mostly general hospital, teaching hospital, one, that test may just be free for you. May
Hmm.
just so I'm not saying must be free, may just be free for you. And two, they will give you more informations about HIV so that you will know. If you be positive, they go give you information on what to do. If you be negative, they go still give you more information on what to do. And another thing, Peter, if you want to know more about HIV, just follow my page. Get so many videos on HIV. HIV now you're full on. So anything you want to know about HIV is there. So for you, just go and do the HIV test. When you do the HIV test, it will tell you whether you are positive or negative. Now, when you are positive, there are medications that you can start when go keep you alive. If you are
Hmm.
negative and you are at, if you are negative and you think say you are at higher risk of becoming positive, we still get some medication when we will give you when we they call prep, when go prevent you so that you not go become HIV positive. Okay, that's where I will stop. Dr. Fred.
Yeah. Thank you, Dr. Israel. If you just they come and you never share this live session, we are share. Quickly, share. Not be say you go they ask questions and you no go share. That one now winchi be that now. We are share. Now we have a question here from Facebook. This question is from Mary Queen. Mary Queen say, I beg Doke, which test person fit do for kidney function? You, you don't already put the name now. You don't already put the name. When you go to a good lab, a good laboratory,
Okay. for kidney function, you'd already, I feel say that's the name of the test you can do.
Yeah.
However, it's not about doing.
Oh, what happened to Dr. Israel? I thought it was from my end. I thought this was from me. Oh. So I think I know what Dr. Israel they try to tell you. It's not enough to do kidney function test. Because if you do the test and there is a problem, now who won't manage you? And if there is a problem, you don't know, you just go do kidney function test. There might be something else where you don't know. Yes, the name of the test now kidney function test. They know what to do. They go check your urine as well. They will take your blood. But it's not enough to just do kidney function test. Because after you do the kidney function test and there is a problem, now who go come treat you? Who go even help you interpret your results? Who go help you review your results? That is why we dey always beg. Before you do test, get doctor, have your own doctor wey be say e go help you so that you no go do test, you come carry the results, you come dey waka online. Dr. Fredostar, can I send you my result? No, because I no be your doctor. So yes, the name of the test na kidney function test. However, you go also need somebody, you need your doctor wey go help you to know say your result is fine oh, there is no problem oh, there is problem in your result. So hope you understand Mhm. Okay, we go soon finish right now. A friend of mine has HIV and she started treatment early, but she's scared of settling down cause the fear of what people will say and the kind of baby she will be having. Oh my God, which kind friend be this? Make I bring up Dr. Israel, make he answer this question clearly. Dr. Israel, are you back? Dr. Israel, you don't come back.
Yeah, I'm back. I'm back.
Okay, I better listen carefully to this question. A friend of mine
Yes.
has HIV and she started treatment early, oh, but she's scared of settling down. I think she's scared of getting married. Cause because the fear of what people will say and the kind of baby she will be having. How can I be of help? Oh, make una see wahala. Okay, you don't come back.
Yeah, I'm back.
Oh yeah, go ahead. I beg respond.
Okay, I dey see the question. A friend of mine has HIV and she started treatment early, but she's scared of settling down because of the fear of many fear. The fear of
What
what
people say
people will say
and the kind
and
of
the kind
baby
of baby she will be
she will
having.
be having.
How can I be of help? Now, one of the thing is this. Uh, one of the thing is this. One of the thing is this. Your baby will still be negative, whether the person is positive or the woman are positive, the man are positive. It no matter. It does not affect the baby. Yeah. But the only thing is the mother must register with the hospital and must follow every advice and every information when the hospital say make you do. If you follow all those things, the baby will be negative. I assure you of that. And two, it not be now we go come dey talk about wetin people go talk. Whether you be positive, people go talk. Whether you be negative, people go talk. Whatever person do for life, people will always afraid of what people will say. Make she,
Mm,
if you see person wey like am well to marry her, make she
mm,
marry, give birth to her children, and take
mm,
care of herself and the children. It no
mm,
matter the status, whether she's positive. I mean, you see, for this country, about 1.9 million people are positive. In fact, that one na just wetin data tell us. It may just be more than that. Even
Mm-hmm.
recent data, some place that they say that they see 2.1 million people. So it may even be more than 1.9 when we they talk. And out of that 1.9, we say now only 1.7 million people neither start drugs. So what about the rest will never start drug? Others one figure the
Mm-hmm.
so many things they happen. So make as far as she does start drug, she's even as safe as anything. And another thing is that she feel marry person where they negative. She feel marry person where they positive. If you marry person where they negative, so fine they take her drug very well. If they take a drug very well, e no go even fit transmit the virus to the person where they negative because e go if she dey take her drug very well or e dey take e drug very well, e go come reach that point wey we dey call when e viral load go come dey very low. We go come dey say this person dey undetected. And when it's now undetected, e no go fit transmit the virus. Now that one we dey call undetected is equals to untransmissible. So that time, even though you marry somebody wey dey negative, e no mean anything. And e go give birth to a child and all the child go dey negative.
Mm.
However, if na positive person you still see marry, e no matter. They go still give birth to children and the children go still dey negative. It's just for this person to know the right thing to do, get the right information, go to the
Mm.
right hospital, and everything will be fine. And make e no dey think wetin people go talk because people go always talk. That na one thing. People go always talk. Hmm? So if you also really need to know more, just follow my page. You'll see many things about. I even make one video when I thought say whether you be positive or people go talk, you be negative or people go talk. If you be positive, people go talk, say, hey, you be positive. If you die, that same people when talk say you be positive, then go see talk say, so you know say drug, why you not go take drug? May you for not
Mm.
die. That same people. And
Mm.
if you see decide say you no go marry, you no go born because you be positive, that same people that go sit talk say so you even know say if you marry, you go fit give birth to pikin wey dey negative. Why you not marry? So why should we use our body dey wait for wetin people go talk? Make we
Mm.
no mind wetin people go talk and more live our life. Everybody get your own life to live. Don't follow wetin people go talk.
Okay, we are out of time. Our time on the live session don't almost finish. So if you just dey come, sorry, you came late. I like wetin you talk. Anything you do for this life, people go talk. So tell your friend to live her life, take her medicine. If she see person wey like and wan marry am, she get married, and all her children go dey negative, nothing go do am. This is why we are on this page, giving you information that you can go to anywhere in the world and confirm. We know they do Chebikambia with a guess. When we open our mouth talk, we are 100% sure. If we no sure, we go tell you say we no sure. That is why we are here to help you. But our people go dey play. They even share this video to save their family. They no go share. So I beg you, tell your friend, say, may she go live her life and not listen to what anybody will say. One more question and we are over. One more. Okay, let's take this last one. Doctor, please, what could be the cause of repeated miscarriages after 3 children? Two are cesarean section, and the last one was vaginal delivery. Dr. Israel.
Yeah. Okay. The only thing where you catch my attention, he said after 3 children. I said, I don't know. You're in Nigeria. You don't born 3 children. I don't know what we see they look for. That's by the wayside. Now, having repeated miscarriage, first of all, we want to know when you they get the miscarriage. Is it the first trimester? Is it the second trimester? Is it early pregnancy or middle of the pregnancy or the last period of the pregnancy? If not
Mhm.
very early pregnancy, most of the time now hormonal problem and they cause miscarriage during the first time of pregnancy. And sometimes malaria fit cause am, but hormonal problem. Wetin e mean be say sometimes the body notice say even the baby not to make sense. When the body notice that one say the baby not to make sense, the baby not they get everything we go get to make am really to become real human being, the body go remove am. So now they make some people they get miscarriage in the first trimester. And
Hmm.
that fit dey happen most of the time within the 10th weeks, nine, 8, 9, 10, 11 weeks that they happen. So, but if na the second trimester, then that one fit be different thing na dey cause that one. One of the thing wey fit cause the second trimester miscarriage, that is after the early pregnancy. One na uterine incompetence. The uterus no go fit hold cervical incompetence, sorry, cervical incompetence. E mean say the cervix no go fit close to hold the pikin up. Dat na one. Two fit be infection fit cause am. Another one fit be say um oh God, I don dey forget some of all these things.
Plenty thing.
Dr. Fred, maybe you
If it
can
be maternal, if it be maternal issue from the woman self, if it be from the
yes,
woman, you understand? Yeah. So
the woman
when
and all
yeah,
that.
yeah. So recurrent miscarriage, no
So
be something.
because
Okay,
of
go
that,
ahead. Go ahead.
yes, because of that, the person fit dey get miscarriage mostly that during that period. So even the last time, maybe medication sef, some medications wey we dey take fit still even be the cause of all this miscarriage. So what I will advise this person for as far e dey get this miscarriage, recurrent miscarriage, I don't know how many times, e will need to make sure say before e get belle, make e start to dey see a gynecologist. When e don get
Mm,
belle, make e continue to dey see the gynecologist. So the gynecologist will be the one to follow this person up until e born, so that make e no get miscarriage. So if they even see say na cervical incompetence, do some small procedure for that person so that to keep the pikin. But if na hormonal issue, most of the times there may be little or nothing when they go fit do for that hormonal thing, because wetin the body see na e take act. E fit just see say this pikin no, the pikin no go.
mm,
Sorry oh, I wan go this other route. If you don get three children, I don't care the gender, whether na three girls, whether na three boys. I don't care the gender, whether na boy and girl. I don't care the gender. But I think, and you get these three children and you dey stay for Nigeria, you dey stay for Nigeria. I think that you should be glad that you have three already and it should be okay. And I don't think you should be looking for more, except maybe now another you get a new partner. That one different. You get a new partner, that one fit come be another book, another story.
Okay. Thank you so much, Dr. Israel. Now we don't come to the
Dr.
end of
Fred,
this. Yeah. Thank you so much. We know if we take more questions, our time is over. You understand, Dr. Israel? Any final comments as we round up? Final comments.
wow. Okay, what I have to say is I want to thank everybody today when follow us, when join us for this live session. You guys are the MVP, MVP. Very important people. VIP. And you guys are the VIP. And uh, all the, in fact, today's
Wow, I don't know what's happening to Dr. Israel's network. Thank you so much for joining. Thank you, thank you. We have to go. Our time is up. I will see you next Sunday. No come late. If you come late, then we no go fit attend to you. Time is over. We'll see you next week. Remember, good life now waiting. Good life. Na sense. Take care and have a wonderful day. Bye bye.